Liver fluke is a parasitic infection that affects the liver and can cause a range of symptoms, including abdominal pain, diarrhea, and weight loss. What is liver fluke? Liver fluke is a parasitic infection caused by a type of flatworm called Fasciola hepatica. It is one of the most common parasitic infections in animals, and it can affect a wide range of species, including cattle, sheep, goats, and even humans. Types of liver fluke. There are two main types of liver fluke, Fasciola hepatica and Fasciola gigantica. Fasciola hepatica is the most common type and is found in many parts of the world, including Europe, Asia, and Africa. Fasciola gigantica is found in Southeast Asia and is less common. Characteristics of Fasciola hepatica appearance. Fasciola hepatica is a flatworm with a brownish-green color and a length of up to 30 centimeters, 12 in. Habitat. It is found in freshwater environments, such as rivers, lakes, and ponds. Hosts. It infects a wide range of hosts, including cattle, sheep, goats, and humans. Symptoms of liver fluke ***. Symptoms of liver fluke. Liver fluke can cause a range of symptoms, including abdominal pain. This is one of the most common symptoms of liver fluke, and it can be severe. Diarrhea. Liver fluke can cause diarrhea, which can be bloody and watery. Weight loss. As the parasite grows and multiplies, it can cause weight loss in infected animals. The life cycle of the rumen fluke is quite complex, involving various stages that require specific environmental conditions to thrive. The parasite's life cycle is heavily influenced by the environment, especially when it comes to the intermediate host. The life cycle of the rumen fluke is also influenced by the host's immune response, with the parasite using various mechanisms to evade the host's immune system and avoid being detected. The life cycle of the rumen fluke has been the subject of scientific study, with researchers investigating the parasite's ecology, behavior, and transmission dynamics. The larvae are ingested by the animal through contaminated feed or water. The adult flukes then attach to the intestinal wall and feed on the nutrients absorbed by the animal. The rumen fluke, a parasitic menace to livestock. Introduction. The rumen fluke, also known as Fasciola hepatica, is a parasitic flatworm that affects cattle and sheep worldwide. This article will delve into the life cycle, symptoms, and impact of the rumen fluke on livestock, as well as discuss the measures being taken to control and prevent its spread. Life cycle of the rumen fluke. The life cycle of the rumen fluke begins with the ingestion of contaminated feed or water by the animal. The impact of rumen fluke on livestock. Rumen fluke, also known as liver fluke, is a parasitic infection that affects the digestive system of livestock, particularly cattle and sheep. The parasite, Fasciola hepatica, is a type of flatworm that can cause significant harm to the animal's health if left untreated. Symptoms of rumen fluke infection. The symptoms of rumen fluke infection can be severe and debilitating. Rumen fluke infection can have significant impacts on the health and productivity of ruminant animals. However, this method is not always reliable and can be affected by various factors such as the quality of the sample, the skill of the laboratory technician, and the presence of other parasites. Understanding rumen fluke. Rumen fluke, also known as Fasciola hepatica, is a parasitic flatworm that infects the digestive system of ruminant animals, such as cattle, sheep, and goats. The parasite is typically found in the rumen, a compartment of the stomach where food is first broken down. Symptoms of rumen fluke. The symptoms of rumen fluke infection can vary depending on the severity of the infection and the individual animal. However, common symptoms include diarrhea, weight loss, loss of appetite, abdominal pain, vomiting, blood in the stool. Diagnostic testing. Diagnosing rumen fluke infection can be challenging due to the limited availability of effective treatments. The most common diagnostic tests are fecal examination. This involves collecting a stool sample and examining it under a microscope for the presence of the parasite. Blood tests. These can detect the presence of antibodies against the parasite in the blood. Imaging tests. These can help identify the location and extent of the infection. The problem of rumen fluke. Rumen fluke, also known as Fasciola hepatica, is a parasitic flatworm that affects cattle. It is a significant problem in many parts of the world, particularly in tropical and subtropical regions. The parasite can cause a range of health issues in cattle, including reduced milk production, weight loss, and increased mortality rates. The parasite can be found in contaminated water, soil, and feed, making it a widespread issue. It can also be spread through direct contact with infected animals or contaminated equipment. The parasite can cause significant economic losses to the livestock industry, with estimates suggesting that it can cost up to 10% of the total value of the cattle. The importance of effective treatment of Rumen fluke is critical to preventing the spread of the parasite and reducing the economic losses associated with it. The use of oxyclosinide is a key component of this strategy. The role of oxyclosinide is the only active ingredient available that is effective against Rumen fluke. It is a broad-spectrum anthelmintic that can be used to treat a range of parasitic flatworms, including Rumen fluke. Treatment and recovery: oxyclosinide is administered orally, typically in the form of a paste or granule, and is usually given to the animal once a day for 3 to 5 days. The treatment is usually given in the early morning, and the animal is closely monitored for any adverse reactions. The dosage and duration of treatment may vary depending on the severity of the infestation and the age and health of the animal. The treatment is usually given in a series of doses, with the first dose being the most important. The animal should be kept in a quiet and comfortable environment during the treatment period. The larvae can cause damage to the intestinal lining and lead to malabsorption of nutrients. The importance of Rumen fluke diagnosis: Rumen fluke, also known as Fasciola hepatica, is a parasitic flatworm that affects cattle and other ruminants. The parasite's life cycle is complex and involves multiple hosts, including cattle, sheep, and the intermediate host snail. The life cycle of adult Rumen flukes: adult Rumen flukes live in the rumen or stomach of cattle, where they feed on the animal's digestive fluids and nutrients. The role of the intermediate host: the intermediate host is a mud snail that tends to live in heavy and wet soils. The parasite uses the snail as a temporary home, where it can complete its life cycle. The snail's role is crucial in the parasite's life cycle, as it provides a safe and suitable environment for the parasite to develop and multiply. The snail's habitat is typically found in areas with high levels of organic matter, such as wetlands, marshes, and riverbanks. The life cycle of Rumen flukes: the life cycle of Rumen flukes is complex and involves multiple stages. The process begins with the ingestion of contaminated food or water by the host animal. The larvae then migrate to the small intestine, where they develop into adult flukes. The stages of Rumen fluke development: ingestion. The host animal ingests contaminated food or water, which contains the eggs of the Rumen fluke. Migration. The eggs hatch in the small intestine, releasing larvae that migrate to the rumen. Development. The larvae grow into adult flukes in the rumen. Egg release. The adult flukes release eggs into the feces, which are then deposited onto pasture. Rumen fluke infection can cause severe health issues in livestock if left untreated. The impact of Rumen fluke on livestock: Rumen fluke, also known as Fasciola hepatica, is a parasitic flatworm that affects the digestive system of livestock, particularly cattle, sheep, and goats. The parasite can cause significant harm to the animal's health, leading to severe consequences if left untreated. Symptoms of Rumen fluke infection: the symptoms of Rumen fluke infection can be subtle at first, but they can quickly escalate into severe health issues if left untreated. A veterinarian should be consulted to determine the correct diagnosis and treatment plan. Understanding Rumen fluke infection: Rumen fluke infection is a parasitic disease that affects the digestive system of ruminant animals, such as cattle, sheep, and goats. The parasite, Echinococcus multilocularis, is a type of tapeworm that can cause a range of symptoms in infected animals. Symptoms of Rumen fluke infection: diarrhea, weight loss, abdominal pain, loss of appetite, increased risk of secondary infections. These symptoms can be similar to those of other diseases, making it essential to consult a veterinarian for an accurate diagnosis. Diagnosis and treatment: a veterinarian should be consulted to determine the correct diagnosis and treatment plan. Many samples will return positive diagnoses for Rumen fluke without being a problem or requiring treatment. A thorough examination and diagnostic tests, such as fecal examination and imaging studies, are necessary to confirm the presence of the parasite. Prevention and control. Preventing rumen fluke infection is crucial to maintaining the health and well-being of ruminant animals. The importance of rumen fluke control. Rumen fluke, also known as Fasciola hepatica, is a parasitic flatworm that affects cattle and sheep. It is a significant problem in many parts of the world, causing substantial economic losses to the livestock industry. The parasite can lead to a range of health issues, including liver damage, anemia, and reduced fertility in females. The challenges of rumen fluke control. Controlling rumen fluke is a complex task, requiring a multifaceted approach. The parasite can be present in the environment, on the host's skin, and in the digestive system. This makes it challenging to identify and treat the parasite effectively. Treatment and recovery. Oxyclosinide is administered orally in a single dose, typically given at the start of the treatment period. The treatment period is usually 3 to 5 days, with the dose being repeated every 24 hours. The medication is usually given with a meal to enhance absorption. The treatment period is designed to target the immature and mature stages of the rumen fluke life cycle. Oxyclosinide is effective against both the parasite's eggs, larvae, and adults. The medication is usually given in combination with other treatments, such as anthelmintics, to ensure complete parasite clearance. Side effects and monitoring. While oxyclosinide is generally well tolerated, some animals may experience side effects, such as diarrhea, vomiting, abdominal pain, increased heart rate, increased blood pressure. Monitoring the animal's health and behavior is crucial during the treatment period. The animal's weight, appetite, and stool quality should be closely monitored. The changes also aim to improve the clarity and readability of the text by using more precise language and avoiding repetition. The hidden dangers of rumen flukes. Rumen flukes are a type of parasitic flatworm that can cause significant harm to livestock, particularly cattle.